So the zygomatic process has a posterior part and anterior part. In the anterior part, this is the anterior root and the anterior tubercle. This is the posterior root. This is the post-glenoid tubercle, which is rudimentary in human being but very much prominent in the mammals. This is the anterior part having an upper border is for the attachment of the gallia aponeurotica and fascia temporalis. This is the inner surface as well as the lower border. This for the masseter muscle outer surface is subcutaneous. So this is the zygomatic process. Now about this one, this is the mandibular fossa. Fossa means the depressed area. In the mandibular fossa, there is an articulation with the head of the mandible forming temporomandibular joint. The mandibular fossa has, I am looking it in this fashion. The mandibular fossa has an anterior articular part and a non-articular part, posterior non-articular part. Anterior articular part is formed by the squamous part and the posterior non-articular part is by the tympanic part of the temporal bone. And the junction between this articular and the non-articular part, there is a fissure known as squamotympanic fissure. Now, this is the petrous part and this is the tegment tympani. I will show you later on why I shall discuss about the petrous part. This tegment tympani has a downturn part. Look very carefully. This is the downturn. This one is the downturn tegment tympani, and this lodges between the squamotympanic fissure, and the squamotympanic fissure then converted into anterior petrosquamous, this one petrosquamous, and the posterior petrotympanic. This is the posterior petrotympanic fissure. From the petrotympanic fissure, three things comes out. The measures are the anterior ligament of the malleolus, number one, the chorda tympani nerve, and the auricular branch of the maxillary artery. This articular area, the where the head of the mandible is attached, form the temporomandibular joint, a synovial joint. So capsule is attached around the margin of the articular part, and in between the two opposing bones, that is the articular part and the head of the mandible, there is a fibrocartilaginous meniscus present. So that meniscus divides this articular part into a squamomeniscus and a meniscomandibular part compartment. This is about the mandibular fossa. Now I shall focus on the tympanic plate. Look from this non-articulated individual temporal bone. This thin plate of bone is the tympanic plate. It has an anterior surface, this one. It has a posterior surface, anterior surface, the posterior surface. It has a this one is the superior quarter, this one is the inferior border and this is the lateral border. So anterior surface, posterior surface, this is the superior border, this is the inferior border and this is the lateral border. Two surfaces and three borders. The anterior surface, this is the anatomical position, so this is the anterior surface, this one. This anterior surface forms the contributor to the non-articular part of the mandibular fossa and it comes in relation to the parotid gland. Now about the posterior surface, that means this surface, it forms the anterior wall, the floor and the lower part of the posterior wall of the external acoustic meatus. Now about the borders. This border is the superior border. It forms articulation with the squamous part and intervening tegment tympani forming the petrotympanic fissure, and this is the inferior border. Here this is the inferior border. Here it splits to enclose the base of the styloid process. This is the inferior border. Here look carefully, it splits to enclose the base of the styloid process and the rest is the lateral border. It forms the margin of the bony external acoustic meatus and along this margin cartilaginous part of the external acoustic meatus is attached. Now its posterior part becomes downturned and forming the posterior part is downturned forming the tympanomastoid fissure through which the auricular branch of the vagus nerves comes out. So this one is the lateral margin. It forms the outer margin of the bony external acoustic meatus with which the cartilaginous part is attached, and the downturn gives an articulation with the mastoid part as the tympanomastoid fissure through which an auricular branch of the vagus nerves comes out. Stop.